no matter how many times you see these videos, there's always strong opinions on NPs or PAs and their role and who's better educated and yada yada. And I think there are some valid points in this, but I can say that one of the biggest things you learn in medical training, especially as a med student or a PA student, is they want you to know the difference between sick and not sick, and who is at the bedside, who typically calls the codes or calls the attending to come to see the patient. The nurse. So they have then identified that there is now a sick patient who wasn't sick before, or there was a clinical change. That is an important skill that you gather as a resident or a med student or a PA from experience and exposure. In the same way, if I have a baby that I'm concerned about, their belly is distended and they're not tolerating feeds, that nurse knows exactly what I'm going to do next. And sure, it's a little algorithmic. We're going to stop feeds, start an IV fluid, get an abdominal x-ray, and look for an infection. But if they have been around long enough, they know exactly what the next steps are, or they'll call saying, hey, look, this is happening. I think we should do X, Y, and Z. So there are clinical scenarios in which the nurses are heavily involved in. So I think the argument that they're not making the clinical decisions for the patient can be valid in some degree. But if you have a very seasoned nurse, yes, they're not ordering the medication or ordering the next tests or deciding which pressor to use. But if they've been around the block a time or two, they know exactly what the next steps are going to be. And I think that is helpful if they go to NP school. The problem is if you are an ICU RN and then you go to FNP, that exposure is very important that you had in the ICU, but outpatient medicine is a different world than the ICU. So I think that is where some of the feelings that the nurses aren't getting that clinical exposure, or there are some programs where they only require like a year of bedside or no years of bedside, which have caused more issues with the reputation of an NP.